Ectopic pregnancy. What is the definition of an ectopic pregnancy? Ectopic pregnancy is anywhere implantation happens anywhere than the endometrium lining. I may not be saying it right, so you Google fact check me, but I know my stuff because I just got 100%. So endometrial lining. So let's explain it, okay? So right now, endometrial lining. Let's think about a highway, okay? Let's talk about the 405 because everybody hate the 405, okay? So the 405, we want to reach to Euphoria, okay? Santa Monica, Euphoria. Everybody want to go to Santa Monica Pier, okay? If you're a kid. So what you want to do is that if you don't reach your destination, if you go off the 405 and you hit Cheesecake Factory, you know, if you go off and you hit the Getty Image, if you go off and you hit into a ditch, that's an ectopic pregnancy, okay? That is considered not pregnancy. We want to reach to Santa Monica Pier. That is where we will have the freaking pregnancy. Every woman want to get pregnant. Some women want to get pregnant because they want to have kids, okay? So that is what we call ectopic pregnancy, okay? Now let's think about this. Now, if we go to ectopic pregnancy, because we went to the Getty or we went to Cheesecake Factory, remember? We got ectopic pregnancy, okay? Now, let's think about this for another minute. So, we want to diagnose. So, how do we diagnose? Okay, so in the woman's vagina, there's this little cone-like thing, right? Cone-like thing called the cervix. That cervix in the woman's vagina is where we'll start diagnosing with something that's called my man named Cullen, okay? My homeboy named Cullen. Cullen sign is what diagnosed for ectopic pregnancy. You got it? My homeboy Cullen. All right, so let's think about this again. Now, if there's an ectopic pregnancy, if it's not severe, we can treat it with methotrexate, okay? You may be like, what the hell is methotrexate? Methotrexate is a drug that helps with ectopic pregnancy. You know what else you use methotrexate? If you are going to have an abortion, you'll use methotrexate. That's what you use methotrexate for. That is for minimal. But if you have severe, oh man, this is what you call immediate surgery. Immediate surgery. You want to draw labs. You want to go ahead and call the doctor because we need to get these remnants out of the uterus. The uterus. What is the uterus? The endometrial lining. What is that? Santa Monica Pier. We run it back. You are common places. Remember the 405. 405. If you have an accident on the 405, which is called your fallopian tubes in scientific terms, or fallopian tubes, that tube is called the 405. All right? If you live in California, you know what I'm talking about. If you don't, you need to get to Euphoria, California. Peace out. Have a good day.